Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we're talking about the biomarker hs-CRP. Can an inflammation blood test detect heart disease early? Last time I went to my doctor, I had to get blood drawn for some lab work. Phlebotomists took some blood, sent it off to wherever it goes, and a day or so later I learned that all my numbers were in the normal range. This simple, relatively easy process belies some of the amazing research and technology behind lab work. Let's focus on just one test, high-sensitivity C-reactive protein, also known as hs-CRP, as an example. An hs-CRP test can cost the consumer around $60 and is sold as an inflammation test, which may predict heart disease. Under the hood, though, investigations into hs-CRP began in the 1930s and are still undergoing intense scrutiny for its predictive value for measuring heart disease. Let's dig into this biomarker and what it might be able to tell us about our cardiovascular system. High-sensitivity C-reactive protein is a nonspecific inflammation marker. Nonspecific here means that it rises in response to many different causes of inflammation. Acute, or sudden and short-term, inflammation causes include tissue injury, bacterial infections, and burns. Chronic or long-lasting conditions that may raise hs-CRP include pregnancy, obesity, insulin resistance, smoking, age, depression, hormone therapy, cardiovascular disease, and alcohol. Immediately, the potential to predict cardiovascular disease is apparent. Many of these conditions take a long time to develop, and most of them will lead to serious cardiac problems given enough time. Getting an early warning could be critical to determining the risks and starting treatment. Because of this potential, researchers have been investigating hs-CRP for its ability to predict cardiovascular risks, including heart attack, stroke, coronary artery disease, and sudden cardiac death. hs-CRP values fluctuate and can be affected by acute changes, but investigators have found that consistently high levels of hs-CRP above 2 or 3 milligrams per liter are associated with increased cardiovascular risk. So how does hs-CRP predict cardiac problems? High-sensitivity C-reactive protein binds to bacteria and dying cells and activates our immune system. It recruits our complement pathway, part of the innate immune system, enhances coagulation and blood clotting, and facilitates the release of inflammatory cytokines. During an infection or tissue injury, these are great features. But when chronic conditions keep inflammation high for a long time, the body, including the cardiovascular system, suffers. Some evidence indicates that hs-CRP may promote blood clots around ruptured cholesterol plaques in the bloodstream, but there is actually significant debate on how much of a role it plays in causing cardiovascular disease and how much it just indicates it. Regardless of blame, what can be done for people with high levels? For people who have high hs-CRP levels, most of the ways to bring inflammation down are cardioprotective in multiple ways. Weight loss, a good diet, and exercising significantly affect hs-CRP levels. Exercising more than once a week is associated with a 23 to 30% reduction in hs-CRP levels compared with exercising less than once a week. Smoking is also a huge indicator of heart disease and hs-CRP levels. Smokers are 70% more likely to have high levels, though this risk drops to about 20% in former smokers. A physician may recommend low-dose aspirin to help lower inflammation and to prevent heart attack and stroke. Using hs-CRP as an early indicator of heart disease risk has also led to exciting clinical research studies. The Jupiter study enrolled 17,000 healthy participants with high hs-CRP levels but normal cholesterol and preventatively prescribed statins, a cholesterol-lowering medication. This double-blind, placebo-controlled study found that those with early statins had significantly lower levels of cardiovascular disease and death. Other studies, including the 10,000-plus patient CANTOS study, have looked at targeting the inflammation that leads to high hs-CRP levels, though we aren't at a solution yet. Clinical research is ongoing in this active field, and there may be research opportunities available now to study hs-CRP. So next time you get blood work, take a minute to appreciate the hard work, effort, and amazing science behind the test results. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.